Hi, everyone, and welcome to today's webinar about CIN's Behavioral Health Integration Affinity Group. Excited to share information about the opportunity, answer questions, and share the deadlines for how to get involved. My name is Rebecca Hargraves. I'm the CIN Program Office Lead, and I'm joined by the CIN Program Manager, Vanessa Valera. Our agenda for today is pretty straightforward. For those who aren't familiar with CIN, there may be a few of you on the call or listening to the recording, so we'll briefly review that, and then we'll dig into the affinity group opportunity, talk through deadlines, and go through any questions that may come up. All right. So for those not familiar with the California Improvement Network, the CIN, its goal is all about advancing the quadruple aim by identifying and spreading better ideas for care delivery and by strengthening relationships between commercial and safety net provider and health plan communities in California. It was launched in 2005 and has gone through a lot of evolution and growth in that time period. It is a project of the California Healthcare Foundation and is managed by Health Force Center at UCSF. Health Force Center became the program office in 2017. The three primary ways that CIN accelerates the spread of quality improvement innovation is through connection, learning, and action. So for those who've been involved with us in this current phase and if you remain involved moving forward, this will be very familiar to you. Connections are all about meeting other people who are doing the work that you're doing, giving each other ideas and support, connecting others to resources, and that all connects to the learning piece as well, learning about what others are doing in their organization and in other parts of the healthcare environment. Learning is a critical component of what we do and what we do together. This takes the form of webinars, workshops, resources that we curate and put out there. Both the connection and the learning piece are really all in service of moving to action, increasing the QI capacity of the partner and member organizations that are part of CIN, and helping organizations do QI, do more of it, and do it more effectively. CIN is known for its 3 times a year partner meetings where we go deep on a topic, hear from experts, learn from each other, and we put out a report based on that meeting so that others who can't be there can benefit from the learning that's done in that place. We also do things like action groups and affinity groups to help others come together and tackle a critical problem in healthcare. Briefly, the main components of our networks are partners, managing partners, and members. Partners are the core of the network. We have 17 amazing partner organizations this phase. They are commercial and safety net provider organizations, health plans, and QI support organizations. We also have members. We have a 4,500 plus member group, and this is comprised of those who are engaging or interested in QI who've signed up to receive CIN content. So while the primary focus of much of CIN programming is on partner organizations, a very specific goal is also to create resources and programming and disseminate what we do with partners out to our broader member group. You can find much more information about CIN on the CIN website, which is chcf.org/CIN. Our partner organizations for this current phase, which is 2018 through 2019, are here on this slide. It's an amazing group of organizations. And for this affinity group opportunity, these are the organizations that will be participating. Those who opt in will be your colleagues from these places. All right, so just to wrap up the background on CIN, in order to really make progress against its overarching aim and goals, we've gone through a iterative and strategic sort of 6-month planning process with partners to get their feedback, really understand what issues are most important for CIN to focus on in the next 2 years, and this is where we've landed. These 5 topics may continue to iterate depending on the needs of CIN and the broader environment, but you can see here, these are the ones that partners have identified as their highest priorities and most critical to advancing their work. Today, we're focusing on this first one, making improvements in behavioral healthcare with an emphasis on risk and cost management. Okay, great. So the CIN Behavioral Health Integration Affinity Group. So an affinity group are individuals in similar roles or who have shared areas of focus in their work who come together to learn and improve on a pressing issue. This Behavioral Health Integration Affinity Group is a little bit different than other affinity groups that CIN has supported in the past in that it has a specific charge and has financial resources allocated to this group to make progress on that issue. The reason we are focusing on a behavioral health integration affinity group is because it's a top priority for partners to make progress in this area. There is demand from partners and members for programming and resources in this area, and the structure of an affinity group is well suited to cross-sector collaboration, which is the heart and soul of CIN. Okay, so into the specifics. The BHI Affinity Group will be a collective of improvement leaders from partner organizations who come together to identify and select a specific challenge or issue related to behavioral health integration to address. The one addition is that while there is tons of room for what the specific issue or challenge might be, there must be an aspect of managing risk and total cost of care, as that is part of this topic area that's so critical to partners. After the group selects a specific challenge, they will work together to design a strategy or solution to address the issue that takes into account available resources, time constraints, and the purpose of CIN programming. Once that strategy or plan has been developed, the group will work with the program office and other partners to implement the plan to address the issue. The group will also help to inform the content and activities of the September 28th, 2018 partner meeting that will be focused on behavioral health care. So these are the 3 core steps: select a challenge or issue, develop a plan to address it, and then implement the plan. And it's intentionally left broad because what the group wants to work on will be highly dependent on who decides to be part of this group, what's most critical to their work, and what priorities for their organization. Here is the timeline for this work as we currently see it. We anticipate about an 8-month timeline, so as you're thinking about your priorities and commitment to this group, it's something to keep in mind. The first half would be focused on planning, identifying the issue, developing a plan, and then hopefully by the fall, the group will be ready to move to implementation. And of course, the September partner meeting focused on behavioral health is also in the fall. You'll see that after December, there's a question mark about ongoing collaboration. And that's because this group may decide they want to continue working together or supporting each other, or at the very least remain connected in some way. And the program office wants to be able to support the group however it organically evolves. All right, we've just discussed what the charge or the opportunity is and the timeline for getting this work done, which is very exciting. So how will this group be supported to get this work done? First of all, there are financial resources that have been allocated for this group of $20,000. The program office will work with the group to figure out what's the best way to use these resources. And ideally, we would disperse these in a couple of grants. There will also be meeting support. So someone from the program office team, the same individual, will attend all group meetings. They will also provide logistical support, such as scheduling, and they will collaborate with the group to set the agenda for the September partner meeting. Strategy support will also be something the program office will provide. This includes providing a summary of the existing CIN information related to behavioral health integration. And this includes data that we've collected from partners about the kind of programming they are interested in, the challenges related to behavioral health integration they are dealing with, and the current work they are doing in this area. We will also be able to provide feedback on potential solutions and strategies and help connect them to other resources and individuals who might help them advance the work that they're doing. In terms of expectations and commitments of those who participate in the affinity group, the primary one is active participation and commitment to achieving the group's purpose. Again, we expect this to be about an 8-month commitment. And what we ask, hopefully, is that those who join, that this is a priority for you and your work, and it's an organizational priority as well. The participants will also be expected to meet regularly by phone and video conference call. We expect this to be a minimum of once a month and likely twice a month during the early planning phases. There will also be an element of outreach to assess options and design a compelling strategy, so whether that's within your own organization or outside of it with other partners, but there will be an element of doing some of the work to figure out what's the right issue to tackle and what's the best way to address it. And finally, the group will be responsible for identifying a chair or 2 co-chairs to take on a leadership role and help to lead the affinity group. The affinity group leaders, as might be expected, will have additional responsibilities, and this includes setting the agendas and facilitating the group meetings, leading the development and implementation of the strategy, and serving as the primary liaison with the program office. All right, who should participate? So this opportunity is open to individuals from Phase 6 partner organizations. If you are on this webinar or viewing this recording, you most likely are part of a partner organization. If you're not sure, you can click on the partner website page on the CIN website. So again, that's chcf.org/CIN, or you can reach out to us and we can answer that for you. You do not need to be the primary or second contact for CIN at these partner organizations. The ideal participant will be someone who oversees and or leads behavioral healthcare efforts in your organization. Group size is really up to the discretion of its members. So we want to make sure that those who want to be involved, who think that this is critical to their work, have the opportunity to be part of this group. And figuring out ideal size, whether that needs to shrink or grow, will be part of the conversation in some of the early planning meetings. Similarly, figuring out who should be on this group. Again, we want folks to opt in, be excited about this opportunity, and as the group forms, especially once the topic is selected, if the group decides that they want and need other people or other types of organizations to be part of this group, that's absolutely something that can happen, and it's at the discretion of the group as they move forward. So again, we've tried to design this to be flexible and give a lot of latitude for the group to drive what they want to do and who needs to be part of it. So this is sort of the fine print, the details. We hope that you are as excited as we are to join this group. We're looking to get started quickly in May. If you're interested, please email the program office. You can email me by Tuesday, May 1st, 2018. If you're interested in leading the group or taking on a more significant role, let us know when you reach out. And if you're not sure about participating, ask some questions. We're here for you. Call any of us at the program office or me directly, and we can talk through any of those concerns or questions that you may have. And if you have any questions about CIN in general, you can find a lot of that information on the website. Great. So if you have any questions after we've gone through this, please, you can indicate on the chat function in the webinar, or you can speak up on the call. This is a small, informal webinar, so please just let us know if you have any questions. We'll give about a minute for questions. Great, and we know that not everyone could be on this call, and there was a couple of folks who had some audio difficulty. So we'll be posting a recording of this webinar on the chcf.org/CIN website. That will be up by tomorrow. We'll also follow up with our primary and secondary contacts at partner organizations to make sure that everyone has access to that. And if you think of any questions after this call is over, please reach out. All right, thank you all so much and look forward to you joining the Affinity Group. Talk to you soon.